caring Alzheimer's patient during the COVID-19 outbreak. 5 tips. 1. Focus on safe hygiene, because those with Alzheimer's and other types of dementia may forget to wash their hands. Encourages caregivers to be extra vigilant in helping individuals practice safe hygiene. Caregivers can help them do that either by setting up a schedule to do hand washing on a regular basis or having signs in the bathroom or by the kitchen sink to remind them to wash their hands for 20 seconds. 2. Plan for gaps in caregiving. As adult daycare programs shut down and health services become less available due to public health containment strategies for COVID-19, families should anticipate that less help and support may be available for their loved one. This is critical for family caregivers to think about now before there is a problem. If you do have to make a different decision about who's providing care, it's really hard to do that in the middle of a crisis. If you are a spousal caregiver or family caregiver, we want families to have hard discussions and come together to figure out how they are going to fill the gap if someone gets sick. This pandemic is extremely challenging for someone with Alzheimer's disease as they cannot grasp the magnitude of the situation. I recommend for their caregivers' safety, as well as their safety, that they remain at home and avoid medical appointments if at all possible until the situation is safer. 3. Ask care facilities about communication policies. In order to protect the health of their residents, many facilities are restricting access to outside visitors. Attempt to get that employee's cell number and communicate directly via text, video calls with them to see your loved one. Purchasing a tablet and loading it with contact information for family members and friends, photos, social media sites, and games is a great way to keep your loved one connected. 4. Explain the pandemic in relatable terms. Talk to your loved one about the pandemic in a way they can understand. Depending on where they are in the course of the disease, put it in a context that they can understand and don't over-explain if they are not able to grasp it. 5. Practice self-care. Because many people are feeling anxious, it's important for caregivers to practice self-care. We don't know how long this is going to go on or what's going to happen, and one of the things we are telling family caregivers is to be aware of their own anxiety and stress level, because the person with dementia can pick up on that, especially if they can't really understand the context of what's going on.